Hi everyone, thank you for coming despite the heavy rain today. And I see some familiar faces from the previous session as well. So today we have Dr. Ramani from Raffles Hospital. He's a neurologist and he will share about stroke, brain injuries, as well as spinal cord injuries. So without further ado, let's have Dr. Ramani.
Thank you very much. And a very good afternoon to you all. Nice to see you all coming here physically, and I think some are online. Hello to you who are at home or elsewhere. Thanks for joining us today on this presentation on stroke, brain and spine injury, and what these are about and how we can do our best to recover from these illnesses. Some of you may know people who have stroke or who have brain injury or spine injury, or you may just be curious about these conditions. A lot of things have come up recently that help in these areas. Hope to cover them in the course of today. So I'll be covering these three areas primarily, but we can deviate from that if you are curious about these things. Well, we are here talking about the brain. The brain is located right here. It's the center of the nervous system, with many other systems in the body, gut system, heart system. Talk about the nervous system here. That is the main area of focus for this afternoon. It contains many things, largely nerve cells, of course, blood vessels, membranes, and all that. But the nerve cells is what it's full of, and from 15 to 33 billion nerve cells. The number of cells are usually maximal just around birth. They may increase a bit more after that, but as you get much older, the number just slowly does drop a bit over time. The nerve cells and their connections allow the brain to control the body. It allows the brain to help us to move, help us to think, and also it makes sense of the world. And that's how the brain really works. So the brain up here, of course, need blood supply. Blood to bring with it oxygen, bring with it glucose that makes the brain work, and to take away used materials, all the waste products from all the brain's processes. If you're teaching your grandchildren or your children about in PSLE, you may remember some of these words, some of these pictures. Like the brain being up here, the blood to the brain starts from the heart, which is about here, which pumps about 72 beats per minute. This blood enters a large organ called the aorta, from which there are many branches. It's from here, the two big arteries called the carotid arteries, C-A-R-O-T-I-D, arise and run up the neck just on either side of the windpipe or the trachea. It splits at a junction just about here. And this split is important because this is where cholesterol tends to deposit in some people. And this can cause stroke. So this split of the carotids. And then of the split, one branch goes to the skin. So one you see up here, and one goes into the brain, which is the one we are most concerned about, because when that is blocked, that's when stroke can occur. Approximately of the brain supply, 40% comes from here on the right, 40 from the left. How about remaining? 100 minus 40 is 20% left. Where's the rest come from? At the back here, something called the vertebral arteries, which runs right at the back of the neck and goes into the brain. That supplies the remaining 20%. So the brain has got big supplies from the front, smaller from the back to get into the brain cavity. Once it enters the brain, it has many branches. There are branches called the cerebral arteries. The middle cerebral goes to the side, anterior cerebral goes to the front, and posterior cerebral goes to the back, which you see the back arteries over here. There are, of course, many other branches, which are the big ones. So when these vessels block or burst anywhere in the brain, that's when stroke occurs. The brain is so dependent on blood flow. It's a very sensitive organ. Any lack of flow can be devastating. The brain then receives information and sends information out through its extension in the spinal cord, which runs from the brain all the way down the spine, from here all the way to the back, to the bottom. If you look at the spinal cord, actually, really, it's not in orange or purple or green. The whole thing is a gray color. This just to make it interesting. So the orange part is called the cervical spinal cord. Then there's a long thoracic spinal cord, lumbar, and the sacral. And within this cord are many tracks. It's like a highway where many things run. Things going down to control, and things coming up to inform the brain what's happening further up and further down. This gray and white matter is what is seen when you cut through the spinal cord, and the gray matter is largely the nerve cells, and the white matter all the tracks running up and down. From these is where the nerves come out, supplying the arms, supplying the chest, the tummy, and the limbs. So brain, spinal cord, nerves. That's how the brain grows the body. In return, nerves, spinal cord, brain. Now the brain is a very interesting organ. It has many, many segments. And again, I assure you, it is not in purple, green, blue, or yellow. It's all a nice, you like tofu, tau wei. I'm sorry, it looks a bit like tau wei. Sorry to spoil your lunch. But this is how it looks. So the frontal lobe is here. The big frontal lobe is here. It does many important things. Thinking, processing, understanding the world. Memory is from the front. It's the biggest developed part of the brain. That's the frontal lobe. Then the parietal lobe, a bit on the side, on the green you see here, is more of a higher sensory function. The occipital lobe at the back here is largely for vision. And the temporal lobe on the side, just about here, is largely for music and other processes. In right-handers, the left brain controls language. So the left brain is important for language for most people. In left-handers, still most of them have language on the left, though more of them have on the right as well, right instead. So therefore, an injury to here in a right-hander can cause trouble on the left brain. An injury can cause right-sided trouble and can cause language problems. That's how the brain is structured. So therefore, we're very worried about big injuries, big strokes causing symptoms, including language problems. Hiding at the back here is a very important organ called the cerebellum, which helps us in coordination. So those that have a lot of alcohol, too much alcohol for a long time, this cerebellum shrinks in size. They're very unsteady when they walk. And connecting all of these and from the brain to the spinal cord is something called the brain stem. And from there, the nerves to the face and all occur. So this is the brain, cerebellum, and the spinal cord. Now, these pathways mentioned, just to interest you in these pathways. So how does the brain receive information from the skin of the legs, or the hands, or the tummy, or the face? The nerves run from the sensory component into the spinal cord. Then it goes up, and then it crosses to enter the brain on the other side. And therefore, if there's a problem with the brain here, you can't sense on this side. From the brain here, you can't sense on that side. So the sensory system brings information in, so you know what's happening to your body, but it's crossed in how the body is structured. And the same for movement. So to move, say, my left hand, my right hand must say, move this left hand, and then from the top of the brain, the fibers will run down, they'll cross over, and then go down to the spinal cord, and then stimulate the nerves. So you'll see how connected the brain and spinal cord are to receive information, to know what's happening in the world, and to send it down to move things. In the final part, when the nerve reaches the muscle, it makes the muscle move by crossing a place called the neuromuscular junction. And that's another sort of disease occurring in this area. But our focus today is largely on the brain and the spinal cord. Now, there are many symptoms that can occur when there's a nervous system illness. And what symptoms will be felt by the person depends on very much where it's affected. In the brain, some symptoms. Spinal cord, some symptoms. A small little trouble in a big part of the brain in here may cause no symptoms. Something of the same size in the place called the brainstem can be devastating. So therefore, it's not just the location, it's also the size. So big brain problems, which you may have heard about, are of course stroke. So there are two types, from blocking or bleeding. And you've heard about brain injury, which we'll discuss more today. But there are other major brain illnesses, like brain tumors, either growing from the brain, or the brain lining, squeezing the brain, or from elsewhere. Those have cancer, lung cancer, ovarian cancer, can spread into the brain. Another illness in the brain that's major is epilepsy, where they have seizures. The brain may also degenerate, and one may develop dementia, which is largely from forgetfulness. One may develop Parkinson's disease, where there are tremors and stiffness in moving. Among younger people, something called multiple sclerosis can occur in the brain. So these are among the many major brain problems. Well, the spinal cord is also not spared having illnesses. It's very rare, but one can actually have a stroke in the spinal cord. It's very uncommon. Well, we do see it rarely, but more commonly and sadly, the spinal cord injured, for example, falling from a height or from a motorbike accident, having a whiplash, but also are examples of injury. More common is when the spinal cord is squeezed because of wear and tear in the spine. Neck bones and backbones are very mobile, and sometimes a bit of wear and tear can lead the discs to stick out a bit, can lead bony spurs to form, and this can squeeze the spinal cord. And this is the commonest cause of spinal cord symptoms. Trauma is not that common, but trauma is pretty devastating. Very rare are spinal cord tumors, and of course, sclerosis can affect the brain or the spinal cord. So these are among the major illnesses, which of course worry people a lot because they're devastating. They take a lot of cost to treat, and hopefully we can prevent this as best as we can. So let's go through the three big groups. The first is stroke. I'll discuss in the next few minutes in the following sequences. First, what is a stroke? If you already know, just stop me, but we'll just go to the definitions, what stroke is about, and what is new in urgent stroke treatments. And what I think is really important is trying to prevent the first and certainly the second stroke. But each stroke builds on itself. As I mentioned earlier, the brain up here is supplied by many, many blood vessels. They start from the heart, they go up to the front and the back to supply the brain. So stroke happens when this blood flow to power the brain is reduced or in fact stopped. So how does that happen? When the vessel is blocked or it bursts. When it's blocked or bursts, the blood cannot flow. Like on a traffic, when you're along the expressway, you're driving along the CTE, where there's a jam because a car broke down, it's blocking, right? Or if suddenly there's a big flood in the water, a flood on the road, you can't move further up either. So blocking or bursting reduces the flow further up. When the flow is reduced or blocked, what's happening further up gets trouble. And that's how the brain suffers when flow can't reach it. So a blockage here, or a blockage here, or a blockage here can all have a devastating effect. If a small blockage occurs, the effect is small. The large one occurs, people can die because it's a huge effect on the patient. The term stroke is used and people have symptoms due to lack of brain function for a time period. By definition is if the symptoms last 24 hours or more. So one is a weakness, numbness, or slurring of speech, and lasts for one day, 2 days, 3 days, is most likely a stroke that's occurred in the patient. And there are some reasons for defining it. The insurance companies use this for definition. Another term is called TIA. What is TIA? It stands for transient ischemic attack. Transient ischemic attack. Here's where the symptoms, they sound very much like stroke, whether it's weakness or numbness or slurring of speech, but they are very short period. They last a few minutes to at the most a few hours, and certainly less than 24. But we do hope that when a TIA occurs, the damage, if any, is temporary and the brain recovers. And that's why the symptoms go away and the person recovers back to normal. Why does a person have stroke or TIA? The similar reason, which I'll discuss in the next slide. But doesn't mean TIA became weak, recovered, I wouldn't worry. No, we have to worry because those of a TIA have a higher risk of stroke in the time to come. And there is a calculator from research that predicts the risk of stroke after this TIA. Those who are older, those have high blood pressure, those have weakness, more than those who have just only slurred speech, those where it lasts long, those have diabetes, they are the ones with the highest risk of having a stroke after TIA. So one has weakness, and one is younger, one has no high blood pressure, one has no weakness, only slurred speech, for example, very brief, has no diabetes, the risk of stroke is actually small. So this has shown some guidance. If one has these very worrying features, risk of stroke is high. Otherwise, the risk is lower. Doesn't mean it's zero, it just means the risk is lower. So all TIAs should also be taken seriously. So if one has any TIA symptoms, which I'll discuss after this, you must go to a doctor as soon as possible for urgent treatment to prevent the stroke to come. Why do we worry about stroke? Because people can die. In the early phases, large strokes, big blockages, big bleeding, about 10-15% die very early. Up to a third recover fully. The remaining remain disabled to various extents. Actually, it's more severe, the disability, in the early days to weeks to months. But slowly, people tend to recover. But over time, some still remain disabled on the longer term, and they can't return to work or can't enjoy their retirement. So stroke not only kills, stroke also disables. Another concern about stroke is it may come again. So we go to the hospital early to have quick care because we want to reduce early death, reduce disability, and importantly, reduce risk of the next stroke happening. So we urge anyone with stroke symptoms to seek urgent treatment from their doctors. Remember, among those who have a stroke or have been hospitalized for a large stroke, hospital care is not cheap. Singapore is a very efficient, highly effective stroke care system for almost all illnesses, but it's not cheap to stay in a hospital, even though we're on a subsidized class. Some may stay for a long period of time. Some may stay for rehab, and thus that adds to the cost too. And even after one has finished early hospital care, one has gone home, one should still see their doctors regularly, their family doctor or their specialist, to ensure they are treated, their conditions are monitored, and to be given medications. Some are very disabled, have to go to a nursing home, and I think this is a nursing home too. They may come to a place like this because it's very hard to be looked after at home because the high demand of care required for a very disabled stroke patient. In some families, some will quit working to look after the stroke patient. It may be a spouse, maybe a child. Of course, many would hire a helper, which is a bit easier for us because many people are very busy. And also, if we are very elderly ourselves, look after elderly stroke spouse is not easy either. So all this does come at a cost, as you can see, on the person up here immediately, and of course on the family as a whole. So stroke is a very exacting disease and very devastating disease in many ways. As I mentioned, stroke occurs when it's from bleeding or blockage. And you can see this nice picture. The brain's blood vessels may at times burst and cause bleeding into this territory. Less commonly, it bleeds not into the brain, but bleeds around the brain. And that little bleeding point is called an aneurysm. An aneurysm is a small bubble in a vessel that may burst and send blood around the brain. Another kind of stroke, if not bleeding, is blockage. And this is the more common one, where it's blocked for various processes, by various processes. And here, you can see in this vessel, a lot of stuff collecting here. And that collection is usually from cholesterol deposits. And that chances of that is higher, there's high blood pressure, there's diabetes, there's high cholesterol, there's smoking. This damages the brain lining, and then it gets thicker and thicker and thicker, and then clots can form on it and prevent flow further out. So two kinds of strokes, bleeding and blockage. And a small proportion, the bleeding is not into the brain, but bleeding around the brain. Of the strokes due to bleeding, which is about 15% in Singapore and in many parts of the world, though in China, Korea, Japan, this is up to 30 to 40%. Why is that? Largely because of high blood pressure. So uncontrolled high blood pressure is the most common cause of bleeding into the brain. So in countries where blood pressure is high and not controlled, this is the major cause of bleeding stroke, and bleeding stroke is more than 15, maybe 20, 30, and 40%. Less commonly, bleeding occurs because of abnormal vessels on the brain surface, called an AVM. It may be in their birth, we don't know, we don't scan everybody when they're born, but there will be small little vessels in the brain, they're sitting there quietly, and one day they bleed, especially if the pressure is high. Another cause is this bubble I mentioned that can bleed and cause bleeding into the space around the brain. Sadly, doctors can cause stroke too. Certain medicines we give can thin the blood and cause bleeding to occur. Aspirin, warfarin are blood thinners we use to treat illnesses. At times, they can cause bleeding too. Another kind of illness, a stroke, is the blockage type. So with the medical term, we use a hemorrhagic stroke for the bleeding and ischemic stroke for the blockage. these vessels are blocked in the brain or the vessels into the brain. The blockage can be of small branches, which causes small strokes, large vessels here or here, causing major strokes. But 15% occur because from the heart, a clot forms and runs into the brain and blocks a brain vessel out there. Have you heard of a term called AF, atrial fibrillation? If you feel your pulse right now, it's very regular. In some, it's very irregular. And in some, it occurs because of this atrial fibrillation. When this heart beats very irregularly, clots form in the heart, they can fly into the brain and cause a stroke. And this comprises 15% of all strokes. Small artery, about 30-40%, 30-40%, about 15% over here. Among young people who have stroke, they have no other reason to have stroke. They don't have high blood pressure, diabetes, cholesterol, and they have a stroke of unknown cause. It's not from the heart. It's because their blood clots easily, forms clots very easily. It's a very rare cause of stroke, but in the young, we look for this rare cause. But overall, strokes occur from bleeding or from blockage, and commonly because of narrowing of blood vessels, small or large, less commonly from the heart, clots run into the brain. Here are some gory pictures, a bit unpleasant to look at. So here is bleeding. So this person sadly died when they cut the brain. You can find the blood deep in the brain. And this is the common side of bleeding from high blood pressure, uncontrolled high blood pressure, or a long history of high blood pressure. A small vessel bursts and bleeds into the brain. Hemorrhagic stroke from high blood hypertension. Another cause of bleeding is the bleeding around the brain. When an aneurysm, the bubble ruptures, the blood leaks around the brain. And that's the aneurysm you see over here. Another cause of bleeding in the brain is when these vessels are born with, like the abnormal vessel like I mentioned, they can bleed to and cause bleeding to the brain. So these comprise about 15% of strokes. The most common remains this, from high blood pressure. Less common are these two. 85% occur because of blockages, and most because of atherosclerosis. You wouldn't believe it, but this is taken, I understand, from the aorta, the big vessel, from a young person. You know why all this cholesterol deposits there? I know you all don't do it. It's all those, sorry to say, pizzas, McDonald's, other unhealthy stuff. All this food which clogs up the body system, more the body can cope with, and this deposits in the blood vessels everywhere. Not just aorta, in the heart and the brain. And that's atherosclerosis. High blood pressure, diabetes, cholesterol, smoking, all aggravate the process and cause the blockage of brain blood vessels. Here are some brain scans. So one goes to see a hospital urgently for stroke-like symptoms. The doctor will take a history, examine, and then usually order a brain scan. The commonest scan used is something called a CT scan. It's an X-ray based scan. It takes less than 5 minutes. One lies down into like a donut-like structure. They quickly scan the brain very quickly. Within a minute or two, the pictures are seen. This is a scan taken at this level also. And this you see here is the skull, the white thing above. And the gray thing is the brain. If I draw a line to the middle, this is the left brain, this is the right brain. They should be pretty similar. What you see that's abnormal, this big white patch, that's blood that's flooded into the brain. So this person, I'm just guessing, went to hospital because he or she suddenly became weak on the right side, couldn't talk clearly. Rushed to hospital, made some headache as well. Rushed to hospital, doctors found his right side paralyzed, the face also drooping on the same side, and then went to the scanner and they found this bleeding into the brain. The other cause of stroke from bleeding is, like I said, bleeding around the brain. And here could be that of a young person who at a discotheque, maybe was drinking too much, very excited, had sudden severe headache, worse than life, bang, it hit the person. Very bad headache and collapsed to the ground. Rushed to hospital, found to be drowsy. And on the scan, you'll see the skull as per normal. The brain is a bit gray, yes, as per normal. But all this white stuff. This is blood in the space around the brain. And this is called subarachnoid hemorrhage. This is blood in the brain. This is blood around the brain. So this occurs when it's bleeding from a brain vessel in the brain. subarachnoid, and there's bleeding from a vessel around the brain. And they both are quite devastating strokes. The scan may show something else. Person has suddenly had left side of weakness, waited for a few days before coming to hospital, because it didn't get better. And on this CT scan, the skull is a white structure, the gray is the brain. You may notice here this darker gray area. So there's a stroke from a blocked vessel. It's not white. It's a gray color on a CT scan. And you're seeing this large stroke on this side, which can potentially make a person very weak on the opposite side, like on the left. While CT scans are the most widely used brain scans, another kind of scan is called MRI, magnetic resonance imaging. It's a more advanced scanning. It helps us can see things which a CT scan can miss. But MRI has some problems. It's half an hour long. It must be in a noisy little box, and one mustn't move too much, otherwise the pictures are not clear. It's also more expensive. For most purposes, a CT scan is good enough to make a quick decision. What should I do now? Is there bleeding? Is there blockage? Is there a tumor? It's good enough. So they go to hospitals urgently. Often the CT scan is done. If the CT scan doesn't give the answer, they may do MRI. MRI is half an hour long, like I said, more costly and not so pleasant, but it is a better scan, I agree, but there are issues with it too. One is a pacemaker, one can go MRI because the MRI machine will kind of disconnect the pacemaker and it won't work anymore. So there's a problem with MRI. Those have very moving in the machine, very restless, or those who can't breathe and stay comfortable, they will just be even more unhappy in the MRI machine. You know, some can even make it through because half an hour the machine is difficult. On MRI, one sees a stroke. There are many kinds of MRI pictures. In this MRI picture, the stroke you see here from a blocked vessel is the big white patch here. This white patch. So MRI shows the stroke in this person in this manner. So while CT scan is the most widely used scan, MRI is used increasingly in patients to diagnose stroke. It is the better scan. Sometimes the MRI is normal. So here's a person who come to hospital maybe for right-sided weakness and can't talk. CT scan, normal. MRI scan, normal. You say, what's wrong with this person? I can't talk, is weak, but the scans are normal. That's because the scan was done so early, the MRI and CT didn't yet show the changes. So a special MRI called a diffusion MRI may show these changes within a few minutes. The conventional MRI may take an hour or longer to show some change. Within minutes, one can see on diffusion these changes. So on this, now all hospitals have this in Singapore. Singapore is very fortunate. We have very good systems everywhere. And now you have this MRI showing this big stroke, which could not be seen on the earlier scan. So all hospitals now, when the CT is negative, and they really want to know, then through MRI. If negative on MRI, they automatically do a diffusion as part of the package to look for this stroke from a blocked vessel. So we can diagnose stroke very well by taking a good history, examining, and doing the appropriate tests. But before we do that, when we crash hospital, the doctor will say, Mr. Lim, Mr. Tan, or Mr. Abu, what's wrong with you? What are the symptoms? Or we'll ask the children, what happened to your mother? What happened to your father? Well, quite often, when there's a stroke symptom, they occur very suddenly. Then we say at a coffee shop having a tea, or they may be sleeping and they wake up and they found, hey, how come I can't move on one side? So many occur suddenly, but may only be noticed after going to sleep very well in the morning, something is not quite right. Often it affects half the body. Like this stroke occurs in the brain on the left or the right, so often the other side gets affected, usually. Of course, a big stroke was very drowsy and everything gets affected. But often it's half the body being affected, causing weakness or numbness. Often the speech may not be clear. If the stroke occurs in the language center, it's a big one, the talking will be difficult, they can't understand maybe, or they can't produce sensible conversations. Up to 40% have difficulty swallowing. They choke, especially on water and liquids, more than solids in the acute phase. Some strokes, they see double. Look at one shadow, they see two. Or they can't see at all. So all this depends where in the brain the stroke has occurred. When there's bleeding in the brain, they often have headache. Not small bleed, but big bleeds. It's the worst in the life. 10 upon 10, like someone took a hammer and whacked them on the head. they feel like that. That's why they tell you, suddenly something hit me and I just couldn't take it, and I collapsed. And some come in a coma. Something called the FAST is what we teach everybody in the public to recognize. If you think somebody has a stroke, you can do this very simply. Ask the person to please show me a smile. The face is crooked, that's already one possible sign. Next, lift up your arms. The arm drifts down, another possible sign. Next, say, give me your name. If it's not clear, another sign, speech. If any of these are there, quick, there is no time. Quickly call the ambulance. The number in Singapore is 995. Was 999 many years ago when you and I were growing up. It's become 995 now for the younger ones in the room, sitting at the back there. Okay. So I've mentioned to you what is stroke, how we can be diagnosing the stroke. The question is, so who is at risk? Who are those who are more likely to have stroke and those who are less likely? Let me first say, nobody has zero risk. Nobody. But some have higher risks than others. Some things we can't change, especially getting older. And aging is the strongest risk factor for stroke, which unfortunately we cannot change no matter what we do. Being the male, have a high risk for stroke. In some places, like in the US, the American African blacks, they have a higher risk than the whites. If there's a stroke in a family of a member on a very young age, there may be some genetic causes, or the blood is thicker than usual, and they may bleed more easily. But commonest is getting older, a bit more in men and in some ethnicities. But clearly, we cannot change this, although we very much would like to. There are many we can change. We can modify them. The strongest being high blood pressure. High blood pressure can cause cholesterol deposits, can cause bleeding in the brain. And this is the single most important treatable risk factor for stroke. But to spend 1 cent on stroke prevention, spend the money on high blood pressure, on blood pressure control. I don't mean drugs. I mean eating healthily, losing weight, cutting down the salt. The pressure is still high, medication to bring the pressure down. The other thing is cigarette smoking. Again, like blood pressure, damages the vessel wall, cholesterol deposits, and then causes blockages. Diabetes mellitus, high blood sugar on a prolonged period of time, again damages the blood vessel, causes narrowing and clots to form. High cholesterol, same process. So when the damage of the vessel, cholesterol enters, deposits more and more and more, and cause blockage to occur, either here or here. The same thing occurs in the heart vessels too. And in some, it occurs in the vessels to the legs as well. You've seen diabetics who have had amputation. Why is that? Because then from the diabetes, the vessel narrows and narrows and finally blocks, and they have infection and gangrene. To save their life, they may need an amputation. So all this tends to occur. This can cause blocking or bleeding. These largely cause blockages. I mentioned about 15% of strokes in the brain that are blocking. It's not because they're blocking here only. It starts somewhere else, from the heart. And this irregular heartbeat is called atrial fibrillation. And most of the heart strokes, heart-causing stroke problems is from atrial fibrillation. It's more in older people. There are other conditions. You may remember the older days when healthcare wasn't so good. There was something called rheumatic fever. Rheumatic fever is when there's infection from a bacteria called streptococcus. Recurrent rheumatic fevers causing sore throat can damage the heart valves. And that heart valve damage makes the heart abnormal in structure. Many get AF and they come with stroke. We still get patients from the surrounding countries who come, young people who come for strokes because of rheumatic heart disease, atrial fibrillation. Sadly, Singapore is a developed country and obesity is everywhere. You all are slim in this room. You just got to see all the fat people. They are at risk for many conditions, including stroke. And controlling overweight is an important way to reduce stroke for sure. And those who have no exercise, again, higher stroke risk. So you see, all these factors are all common sense and they all can be targeted to reduce stroke risk. So one goes to the hospital. Suppose one is somebody, you notice somebody, oh my goodness, He's talking a bit funny, and they don't speak clearly, the face droopy, arm is droopy, you call the ambulance, you rush to hospital, and there at the hospital, they may be asked, the family asks, okay, does your father have high blood pressure, diabetes, cholesterol, smoking, heart problems? What actually happened? Right? Then I've done a scan, and the scan shows a brain blockage. What treatment will the doctors offer the patient? There are a few we have now. For the blocked kind of stroke, that's 85%, few things can be done to reopen the vessel. That reopening is called thrombolysis, breaking up the clot. Breaking up the clot. And this can be given within the first 4.5 hours after stroke starts. Beyond that time, it is not safe. Another treatment, if there's a clot, can try to remove it. For the heart, they put in stents. For stroke, we not quite have a good enough stent yet, but we can remove the clot. It's called thrombectomy. Ectomy is removing the clot. And this can be done up to 24 hours after the stroke occurs. In some people who have a stroke, and the big one starts swelling and swelling and swelling, that swelling can kill the person. And at times, they may remove part of the skull so the swelling doesn't swell across, but swells outwards and therefore doesn't squeeze the remaining brain. This is done only in a few patients. But acutely, we try our best to give patients these two treatments, if they're suitable. What if the stroke is from bleeding in the brain? Usually, we don't do any surgery. Studies show that surgery doesn't make a big difference, but in certain people, it may make a difference in them. So for them, maybe removing the blood clot is helpful. The small number. Where the blood in the brain is blocking the natural water channels in the brain, and the water channels are getting filled up. By draining the brain fluid, they can reduce the head pressure and save life and make life better for the patient. So generally, we don't usually do surgery for stroke. So this clot buster story, when it's a blocked vessel, we want to reopen as fast as possible. The longer we wait, the less and less there's a chance of having a good recovery. And the most recovery occurs within the first 4.5 hours. So the person comes to hospital, we think they have a stroke, we ask, what time did this happen? Exactly what time? Was it 3 o'clock, 2 o'clock, 1:35? Did he wake up with the symptom? Because if we are within 4.5 hours, we can give this clot busting treatment. And studies have shown by giving this clot busting treatment intravenously over an hour, it can reduce in the longer term disability, more have a good recovery on receiving this treatment. It's not cheap, it's $2,000. I think there's a subsidy in the government, hospital about $1,000 or so. So it's cheaper than it used to be previously. And it does not increase the risk of dying, but bleeding can occur. So because it can be beneficial and it can cause bleeding which can kill, we are very, very careful. Just a stroke? Yes. When did it occur? Within 4.5 hours, the benefits are more than the risks. If it's beyond that time frame, we are not allowed to give it because the complications are more than the benefits. So the first is clot busting treatment within the first 4.5 hours. The sooner the better. Doesn't mean you wait until 4 hours, 29 minutes and you give. No. As soon as possible, because the more you wait, the less the benefit. So the first is clot busting from strokes from a blocked vessel. So here you see an example of a person who comes with an acute stroke. This test called angiogram test. They inject a dye and look at the brain vessels. Here, they're going to the front. Here, going to the side. Totally blocked. There is no flow. After clot busting, if it works well, you expect the vessel to open up beautifully. If you're fast enough, you can reduce injury to the brain from lack of flow. Doesn't mean the person have open up, they recover immediately. It's not always like that. They may take some time to recover. And for some, despite opening, they still do not have much recovery because too much damage has occurred despite the early opening. The other is to remove the clot. And here you see an example where there's a clot sitting over here. They put in a process, pass the clot, catch the clot here, and try to drag it out or suck it out. There are many such techniques available now. It's important that we must be able to see the clot in the artery first. When there's a stroke, we'll do a quick scan, inject a dye called an angiogram, and look for the blockages. If a blockage is seen, they can offer the patient this clot removing treatment. This can be used in all strokes from blockages within the first 6 hours if the blockage is seen clearly in the big brain vessel. Beyond 6 hours is not so straightforward. They need very advanced scanning of the brain to see, okay, the block is there for at least now 8, 9, 10 hours already. What do? We do special scans to see, is there some part of the brain that's totally gone, and hopefully it's a small amount, and a large part, if you do nothing, will then be gone as time passes. So in this, those have a small core and a big part at risk, remove the clot quickly, and we salvage that part of the brain. So this is done in all the big centers. All hospitals have this technique. So right now in Singapore, when one has an acute stroke, the ambulance rushes them to Tan Tock Seng, SGH, or NUH. These 3 government hospitals are the ones that can do this. It is scheduled for this treatment. So ambulances will bypass others and go straight there. That's the current practice, as far as I know, when acute stroke is seen and picked up with the ambulance. Like I mentioned, some may have a stroke in the brain, and it gets bigger and bigger and bigger, and it squeezes the brain on the other side. That squeezing can kill the patient over a few days. And therefore, to save the person's life, they can remove the skull. A big patch is removed. So if you see people walking around with the skull is sunken in, because that skull bone was removed for various reasons, including that of large stroke, and this big skull defect is seen. It can be closed actually. When they remove the skull bone on the urgent surgery, they can put the skull bone in the patient's tummy under the skin and keep it there, and later put it back. I mean, it sounds so simple, not so simple, but it can be done. Or they use titanium and put a titanium plate to cover the same area. So this is done to save life in those where swelling is so big, nothing else works. They can do surgery to remove the skull to allow swelling to occur elsewhere. For those who are swelling in the back of the brain, the balancing center, that actually is quite good. It saves life and the disability is minimal, it's small. For those with big stroke here, many who survive are still disabled, unfortunately. To prevent the next stroke is what we always want to do, right? We don't want to have one. To prevent the next one, there are a few things that we use. For those who have strokes from a blocked vessel, we try to do what they call blood thinners. That's a very loose term. What it does is it makes a cell in the blood less sticky. You remember from your PSLE days of teaching your children and grandchildren, there are 3 blood cells. Red cells to carry oxygen, white cells to fight infection, and platelets to prevent prevent bleeding. Bleeding, they block up the vessel. So these blood thinners will act on these platelets so they don't become so sticky and they will not cause much blockaging. There are many drugs available and they are here. Aspirin, Tacloprine used to be called typically last time. This is called Plavix, the name, it's called Pasantine, these are all the trade names. Huh? But the chemical name is aspirin, Tacloprine, Clopidogrel, other drugs in Singapore, other countries have other drugs as well. In those where the stroke is from the heart, irregular heartbeat causing stroke, they may need something stronger, and that's warfarin. And this is used as rat poison. Because it's so powerful, it makes the person bleed. And therefore, those on warfarin require very, very careful blood test monitoring, which aren't overdosed, which can have a bleeding risk, or underdosed, then it won't be effective. There are new agents available here. You may have seen these names, and those who have seen doctors have done required medicine. They are safer and better than warfarin under good extent. It's a bit more expensive, but they've become the preferred treatment where possible. Whatever happens, whatever blood thinners are used is meant to be lifelong. For some strokes, they may do a combination in the early weeks or months, but in the end, there's usually one on the long term. There is the risk of bleeding, yes, but the benefits outweigh the risks. So bleeding can occur when brushing the teeth, shaving, knocking somewhere, or even by itself. Older people with very thin skin, they bleed more easily. But overall, the benefits outweigh the risks. Those on warfarin require regular blood tests to ensure they're not overdosed. For those require surgery, a dental extraction, say cataract surgery, or something even minor or major, we tend to have to stop this blood thinner. Dental cleaning is usually okay. We want to start scaling, polishing. Some dentists will proceed, some will say, no, you stop first. If you stop for a few days, that's okay. There's always a risk of stroke, but you want to get this done, you have to do it. But don't forget to restart. But now patients who come, went for cataract surgery, stopped 1 week for surgery, very good, surgery, very good, then didn't restart. After 2 weeks, they had a stroke, but they did not restart the medication. So those who stopped, once the surgery is finished and they have recovered surgery, there's no more bleeding, they should restart the blood thinner unless they're told not to. Some strokes, like I said, many of them blocking. Some are blocking actually is here, in this part where the splits, the splitting portion I mentioned very early part. This splitting portion, a lot of stress occurs in the vessel and cholesterol can deposit here. If this causes a stroke, if it's a minor stroke, this can be fixed by surgery. It's called endarterectomy. So here's a person who had a stroke and the test showed a very narrowed segment over here. So this segment, they can actually remove the blockage by the surgeon. They, under general anesthesia, make an incision, open the vessel, remove that cholesterol deposit and stitch up the vessel. Sounds so simple. It's not so simple, but that's what they do it. In some patients, they may do better with stenting. The preferred treatment remains surgery, but in those who are younger, they may prefer stenting for various reasons. Ultimately, it's the skill of the person doing it. And Singapore has both these skills to discuss with the patient and the family. You have the stroke, I'm sorry you have this, you recovered very well, but now we found a very narrow vessel over here, you need to fix it. And we recommend surgery or recommend stenting in the acute case. Whereas focus on bleeding from an aneurysm of the bubble that's burst, we can treat in 2 ways. In the old days, doctor would open up the brain and put a clip across this aneurysm, but things have changed. Now they can put a tube into the vessels and put in coils. And these coils will form clots in the aneurysm and block it up. The risk of bleeding becomes less. So nowadays, when there's bleeding around the brain from aneurysm rupturing, the treatment that's preferred is putting in these coils by the radiologist, or some neurologists do it too, and block it up, and the risk of bleeding becomes less. If it can't be done by this way, they may require surgery. In some people, they put a coil and put a stent across the area to keep the coils inside so they don't leak out. And all these skills are done very early after the stroke. When there's bleeding from these abnormal vessels in the brain, often among younger people, we see that. Some people, it can be surgically removed, but surgery is a big procedure. In some, they can put in little kind of special kind of glue to block it up. And now by giving this glue, it makes it smaller and easier to remove at surgery. In some that are very deep, it's too dangerous to go in surgically and difficult to do this gluing. They may then do focused irradiation, to irradiate and try to burn up that bleeding point. Surgical removal is a cure if it's fully removed. Embolization is a cure if it can be fully blocked up. Radiation takes 1 year to 2 years to have its full effect. So it does take some time, but these are available. For those who are bleeding from a high blood pressure, these are not appropriate therapies. But those who are bleeding from this AVM, these are appropriate and available. To prevent the next stroke, I've discussed all these thinners and surgeries and all that. We must go beyond that. Bring the pressure down, lower the cholesterol, stop smoking, control diabetes, lose weight, regular exercise, minimize alcohol. This is for all health, for the heart and the brain. Similar measures are there. Those who have a stroke, we are even more strict about this. We target a lower pressure, a lower cholesterol. They have to stop smoking, bring the diabetes under control, lose the weight, exercise regularly, safely, and minimize alcohol. So all this has to come all together. That's for stroke. The other big illness now is brain injury. I'll discuss quickly what these are and what can be done. So brain injury occurs when there's something happens to the head, either hit by something or a sudden jolt. There may not always be a skin injury in all these people. They may not always be seen one. Often there is something on the area where it's occurred. We may bump our head onto a door handle, may just slip and fall and bump on the concrete floor. All these are injuries. So they may fly, some killer litter can knock the head and injure us as well. Or accidents, motorbike accidents, they fall off the bike, despite the helmet, they may get injured too. How about falling from a height, as construction workers put people fall, or a sudden blast? All this can injure the brain. It can be a mild injury, called a simple concussion, when the person has a minor injury, a bit confused, but usually not unconscious. They feel a bit unwell, they go A&E, doctor sees them, skull x-ray, and often are sent home. And after a while, a few days, they're back to normal. They may, after a while, they will continue to have some headache, some dizziness, some tiredness, some confusion, some problems, but for a short time, and then it gets better. This is very common. You may have grandchildren, you may have boys, sons who have gone to army and had a fall and had a concussion. Play soccer, it's very common, and they recover fully well. But recurrent concussion is not good. American football, big guys with the helmets, many head injuries cause more than just this. It causes long-term brain damage. But once in a while, knocking the brain, fortunately, can compensate and recover well. In a complex concussion, it's more serious. The effects are longer lasting. On the longer term, they still don't quite get out of the acute phase. They have, on the longer term, problems with thinking, problems with memory, concentration, and they can't always think straight. And there's some say, yeah, I don't understand you quite well. And they may have other things as well, including difficulty hearing, difficulty balancing, headaches. And these are complex concussion we see in major brain injury. Or recurrent brain injury can end up having all these various symptoms. If there's a mild brain injury, had a fall, and the hospital, skull x-ray normal, the doctor said, let's do a CT scan. Often the scan is normal, rarely a fracture is seen. While the brain itself is more severe than severe injury, we might see some blood in the brain. On CT scan, a spot is seen. On MRI, even more clearly seen. If the injury is very severe, all this blood in the brain, in the front of the brain from a fall. And you see it here and here too, in more than one place. In others, there is no blood in the brain, but blood around the brain. And this we see among elderly people. They had a fall, say 2 weeks ago, and they were quite well. And after a few days, they said, my dad is not thinking so straight. Oh, he's walking a bit funny. Then yesterday, his arm is becoming weak, a bit more confused. And the bleeding is not in the brain, but around the brain. It slowly collects. This slow collection is called subdural hemorrhage, SDH. This slow collection occurs among elderly people because when they get older, the brain shrinks. A lot of space in the skull area. The head is moved suddenly, the small vessel bursts, and the blood slowly leaks and forms this kind of bleeding. And this is easy to fix. Relatively easy. You can drill a hole and remove the clot, which will reduce the pressure on the brain. This, this connection is something we do in research using very complex technology, but generally in severe injury, this is what we see. But if you look very detailed, we don't see much injury of the brain like that, but all the connections can be affected by severe brain injury. If it's severe, the bleeding can occur into the brain itself, as you've seen over here, and this is the commonest kind of bleeding after a fall. They fall and they're bleeding around the brain, usually, and sometimes the bleeding can be into the space around the brain. Of course, there are injuries also on the skin, in the nose and elsewhere. So severe injury damages not just the brain, but all the other tissues around it too. So here you see a direct impact causing bleeding over here, or those have a some kind of whiplash, acceleration injury, can have injuries too. There's a blast, a sudden pressure wave damages brain as well. These are various injuries and bleedings that we do see in these patients. Urgently, when they come to hospital with their major injuries, had a skull injury, the fracture, the bone is sunken in, a big blood clot is here, as you can see over here. Right? So these hospitalized, closely monitored, painkillers where needed, cold compress, reduce the bumps and the pain over there. Small bumps, leave alone, don't massage and cause trouble over there. It's a cut in the skin, of course, stitch it up. If serious, admitted, and fractures, if open, may need surgery to be done. The closed fractures and the not too displaced are best left alone. If the fracture has occurred and the skull is moved to a bad position, it's best to fix it. Doctor will advise if that needs to be done. There's bleeding around the brain, they can be removed by the surgeon. But understand that severe brain injury can kill. In the longer term, like I said, with severe brain injury, weakness, numbness, slurring of speech, loss of smell, headache, giddiness. Behavior changes occur too from severe brain injury on the longer term. Fortunately, minor, none of these don't occur. The last one I cover quickly is spinal cord injury, not very common. So this happens in those who had a fall usually. You all know Christopher Reeves, Superman. Unfortunately, he fell off a horse, injured his neck, was paralyzed from the neck all the way down. He's an example of how, despite such a bad event, he's able to still inspire people throughout the world. So when it's injured here, they get paralyzed below the neck. Injured here, paralyzed below the waist. And often falls are the commonest cause, can occur also from an accident. In Singapore, fortunately, there are no guns available, so gunshots are very rare. If it's a complete injury, they're totally paralyzed and they feel nothing below that. If partial, there is some movement, there is some sensory loss, but both are devastating. The terms we use, tetra means four. So often injury here causes both arms, both legs, called tetraplegia. Which below the waist is paraplegia, it's heart which is affected. So the medical terms we use, but all these are features of spinal cord injury. You can see this person had a fall from a height. On the MRI, instead of being a nice curved structure like this, see how the cord is displaced and is squeezing the spinal cord and causes paralysis from the neck down. Another person who fell from a height, and here is a fracture of the thoracic spine, and therefore they were paralyzed below the waist. You can see instead of being a smooth thing, this bone is fractured, causing this problem in this person. So urgently, when there's a spinal cord injury, the Raffles Hospital, they put in the splints, they don't move too much, and they may require, they will require hospitalization usually, maintain blood pressure, oxygenation, and they may require urgent surgery to fix the spine, so it doesn't move up too much or put things in the proper place. Whether stroke, head injury, brain or spine injury, many require rehabilitation to improve the strength, make them more independent. And this should start as soon as reasonably possible. They're having high blood pressure, low pressure, unstable, of course not, but very soon it started to improve the person's recovery. And this goes on as long as the person needs. It does require time, patient commitment, family commitment for this to happen. A team is there, the nurses, the doctors, therapists, all working together to help the person get recovered as much as possible. Rehab is of many types. We must not forget that this is key. We can do all the exciting clot busting, surgery and all that. Rehab is key. Start early and continue as long as the person needs. And there are many centers that offer good rehabilitation. You may have heard about this in the newspapers not too long ago, how a paralyzed man was unable to walk because of injury. They connected the brain to a part beyond the injury, to the spinal cord. And they let the person start to walk. This is really amazing. We hope more and more people can benefit from this. The main aim of rehab is to get a person back to normal living, back to family, back to friends, going shopping, instead of just lying in bed, which is in a very sad state. So try our best to make a person recover, and rehab is so important. So it's important that we re-enable the brain injured and spinal cord injured patients. Despite their weakness, make them mobile. If they have pain and numbness, overcome best we can. Stiffness may require medication. In some, they can't control bladder, can't control bowel, need a catheter or diapers. With some training, maybe it can improve. Sexual function is not talked about, but an important part of life, and this can be something that needs to be challenged and managed best we can. And those who are active before, now can't move, get depressed, anxious, angry, start being a bit psychotic. This can happen, especially in those who never expected it to happen and can't quite cope with it and needing help as well, and a very supportive family. In major brain injury from stroke or direct contact, they start having some memory loss. So to have recovery or rehab is important. Some have tried complementary therapy, and there are many of these available in Singapore. Acupuncture, herbal remedies, massage, tai chi, yoga. There's evidence for some of these, but not all, but they can be helpful. It's important the patient and the family talk to the doctors. My mother, my father have these illnesses. Can they try these treatments? We seldom say no, but say do it in a safe place if you know what they are doing. As always, prevention is better than cure. So for preventing stroke, like I said earlier, control blood pressure, control diabetes, control cholesterol, stop smoking, reduce weight, have a healthy diet, and exercise regularly. This for overall health. To reduce the risk of brain injury is, of course, to reduce exposure to environments. One is when cycling, one is doing skating, one is motorcycling. Please wear helmet, in a car or other vehicle, wear a seatbelt, and be aware of what's happening around you. To prevent spine injury, not easy, just be careful environment. Don't trip and fall and injure oneself. So to conclude, everybody, today, thanks for joining me today. I'll just summarize in a few things. I've discussed very quickly the major illnesses affecting brain and spinal cord, including stroke from blocking, less commonly bleeding, injury from a fall or something falling on the head, and injury to the spine, all of which are very devastating to patient and family, especially if they are major. There are urgent treatments available. If these occur, rush to the hospital for the doctors to assess and give the best possible advice. While we give all the treatments, rehab is important and must be a part of the overall treatment plan with the team. And of course, always we want to prevent best we can. So you may have some questions which they want to ask for me now. I'll be happy to answer best I can. If you have any, I'm happy to take them. Thank you very much. So I think as always, we want to get some feedback from the audience so we can make this a better. So if you like, you can scan this in and give us any comments that you like. Then we go to the second segment of this brief afternoon. Yes, sir.
So what is a mini stroke?
A mini stroke. The question was, what is a mini stroke? So mini stroke refers to the same thing as TIA. So TIA, for a short time, they have weakness, numbness, or slurred speech. So some call this term a mini stroke. So it's not. So it's brought to the attention. It's not something to be ignored. So mini stroke is a term we use in place of the word TIA.
Oh,
TIA is transient ischemic attack. A mini stroke is used to describe the same entity. Right? Doesn't mean minor stroke. Mini just means it's so tiny, it went away quickly, but doesn't mean it's not important. It's still a stroke. So still requires attention. See the doctors for urgent evaluation and treatment.
but sometimes the patient doesn't know that it's not. So
Yes, correct. So sometimes the patient is unaware that something has happened. The family says, how come my mother's not talking so clearly? How come it's dragging the left leg or right leg? So often the family realizes that's correct. But I must agree, some people come to the hospital and they have a scan for some other symptom, and by chance we find a silent stroke. Patient unaware, family unaware, and a silent stroke is seen. When we see silent strokes, we do the test to see what could have caused a silent stroke. We check the blood pressure, check the cholesterol, check the sugars, check the heart, to look for a cause for the silent stroke. It may not require treatment for the stroke itself, but we find high blood pressure, diabetes, cholesterol, we treat these conditions to prevent the risk of a real stroke in future. And the things we do for the brain also protect against the heart. So controlling blood pressure, diabetes, cholesterol, smoking, eating healthy, exercising, all this protect the brain and protect the heart. So you kind of buy one, get one free kind of thing, where you can protect two big organ systems by similar processes. No other questions? I will go to the next page very quickly. Well, this is, I think, sponsored and funded by Moleac. It's a company which I'm not a part of. I work in Raffles Hospital. They have funded some of the research we've been doing on many people in Asia who've done stroke research. And Moleac is one of our funding sources. We're very grateful for them. They're a pharmaceutical company, they're a biomedical company. That is, as you've seen the earlier video on what the company does. We're grateful to them for funding our research. We publish our work, and we hope to do more research to help people get a bit better. And I'm sure you're going to tell them more about the company. So I'll take off the stage now. I'll be at the back of the room and answer questions as when you need. Please ask me. Thank you very much.
Thank you, Dr. Ramani, for the very insightful talk. And I hope all of you have learned a bit about stroke, traumatic brain injuries, as well as spinal cord injuries. So if you have any other questions, you may approach Dr. Ramani at the back later after the session. Yeah, so I'll just continue to introduce a bit about Moleac. So we are, as Dr. Ramani has mentioned, we are a biopharmaceutical company. We have been in Singapore since 2005, so close to 20 years, over 20 years. And we have offices all over the world, so in Singapore, Belgium, and France. and our products actually reach over 40,000 patients every year. So this is a brief overview of our portfolio. We have 2 products. Both of them are already available in Singapore. So the first product is NeuroAiD, which has been around for close to 20 years. And this is our flagship product. It's recommended to improve neurological as well as cognitive functions. And then for the second product, CognivAiD, this is our newly launched product, and it helps to improve age-related mental and cognitive abilities. So what is unique about both of our products is that they are multi-herbal products, meaning we actually take different herbs and we extract the active components of it and then formulate them together to give these products. So our product is unique because of this multi-herbal formulation, which then gives it multiple properties that targets the complexity, the multiple disease processes that occurs in the human brain. So all of our research and studies in both humans as well as in animal models have actually shown how our products work. So we have established mechanisms of action to actually support the use of our products. So what are the benefits of NeuroAiD and CognivAiD? First thing, it helps to improve cognitive functions. So cognitive functions refer to how our brain functions to help in our daily activities as well as functioning. And through improving our cognitive functions, our products actually help to improve the quality of life. So NeuroAiD is, it contains 9 natural ingredients. So we have some herbs like angelica, astragalus, and saffron, and it's in a capsule formulation. And for the second product, CognivAiD, it contains 3 herbal ingredients. So we have saffron, ginkgo leaf, as well as ginseng root. It's also in a capsule formulation. So if you would like to find out more about our products, you can actually visit our product websites, or you can actually ask your physician about it as well. So we have come to the end of today's talk, and thank you very much for attending. Yeah, that's all for today. Okay, thank you so much.